in lasers, as I told you, longer wavelengths penetrate deeper into the target. So longer wavelengths are used to treat deeper targets and to avoid and protect superficial parts of the skin. Shorter wavelengths, in contrast to that, are used to treat more superficial targets and avoid damaging deeper skin parts. This capability allows the experienced pulse light physician to vary the light delivered in order to match the depth of the target and avoid the areas which are not to be treated. So you have to identify what chromophore you have to treat and accordingly use the wavelengths so that you don't damage the surrounding parts or the other parts which are not to be targeted. Pulse light can be delivered in pulses or bursts of light varying from 1 pulse to 5 pulse at one time. So at the target you can deliver up to 1 to 5 pulses at one time, but the duration of each pulse and the delay time between the pulses has to be modified according to the treatment site. Longer durations are generally better for treating larger targets. Shorter pulse duration for smaller structures. So pulse light can be customized for each individual patient. An experienced physician of a pulse light device can customize settings to select the wavelengths, number of pulses and the duration of pulses, also the delay between the pulses and the power delivered to best match the relative depth, size and absorption characteristics of the intended target and avoid the settings that would cause damage to the areas that needs to be preserved. So when I show you the IPL machine, I'll show you how each settings is done. So how you can adjust the wavelength, the number of pulses you give per second, the duration of the pulses between 2 pulses, what time you keep between the 2 pulses, what can be the delay, how the pulses can be delayed, and what power can be delivered to the intended target so that it does not damage the surrounding areas. This flexibility and variability allows the knowledgeable physician to maximize the results and minimize side effects. So if you don't keep a proper wavelength and settings of energy, pulse duration for Indian skin type, there are chances of laser burns while you do even hair removal treatments. The wider range of possible settings and spectrum of light delivered by pulse light enable the operator much broader range of possible settings that is available in single or many combination of lasers. Examples of pulse light machine flexibility include: pulse light delivers wavelengths from 500 to 1200 nanometer, while a laser can deliver only one wavelength at one time. Now pulse light, this IPL has a bit of more advantages and more wider scope of use because it has different filters using different wavelengths, whereas mostly other lasers have only one wavelength at one time. So IPL can deliver wavelengths from 500 to 1200 nanometer. Now, pulse light can deliver total pulse durations of up to 25 milliseconds or 1235 milliseconds, while most laser can deliver pulse durations of up to 40 to 100 milliseconds. And one machine can deliver 1000 millisecond, but only 800 nanometer. Pulse lights laser light beam size follows faster and allows deeper penetration. When you set the settings, these enhanced capabilities are used to target the larger and deeper hair follicles and spare the superficial melanin and darker skin type by using longer wavelengths and larger beams for deeper penetration, combined with longer pulse duration to avoid epidermis harm and targeting the hair follicles. So I've seen patients coming and saying pulse light is far more painful than other lasers, electrolysis and waxing. When you use a pulse light machine, it has a chill tip, but in spite of that, there are chances of burning the patient. So if you have to pre-cool the treatment area, especially with the Indian skin, to prevent the incidence of burning the skin around the target area.